We are here with Adrian. He is the critic for the healthcare ministry.
That's right.
On the Legislative Assembly, and he is the MLA for Vancouver-Kingsway. So thank you for giving us some time.
It's great to be here.
All right.
Great to have you in Victoria, you know. It's exciting. I love Vancouver, of course, you know. I think Vancouver is the best place to live in BC, and it's my home, but Victoria is pretty good too.
It's partly your home now.
Yeah, partly my home, a few days a week.
And when you retire, you're going to move here full time?
No. I'm going to stay in Vancouver-Kingsway.
All right, we have nowpolling.ca, which is a forum for people to give opinions, and I've heard you mention it sometimes you want to have people participating in decision making and ideas, and I'm sure you would support the idea that the NDP brought in 1996, which was the recall initiative.
Right.
And this nowpolling.ca is, in a way, some kind of initiative,
right?
Because we have the framework of topics there, and people go and put their own answers, their own ideas, their own initiative,
yes.
And then other people go, and if they like it, they vote on it. If they don't like it, they write a new one at the bottom of the page. You have the ability to write your own. When you go to nowpolling.ca, you look at provincial issues. This is a list of issues that you find there, or topics rather.
Right.
You know, electoral and legislative topics, constitutional and law.
Sure.
Let's go into health and care services, which is one of the topics actually, and there's a list of topics on nowpolling.ca. If you look at health and care services, you'll find that there are five topics there, because there are different aspects on it. You have the economic accessibility, like who gets to, or how easy it is for people to access it. Do I have the money to pay for an operation? Is there a percentage that I have to pay or not? Are there things that are not covered? Who should provide it, like pay doctors or businesses? And the availability of services is another topic, meaning are there enough services? Are we short? Or we have a surplus of medical workers? We have to ship them to other countries that probably need more than here. And then what does healthcare include? Because the healthcare could have some limitations on, and I've heard you talking about that in previous conversations that we had, that healthcare, you can't provide everything, because cosmetic surgery, for instance, is not necessarily health, although some people can argue that is a psychological need, and therefore is a medical need. But whatever, that discussion is on nowpolling.ca. That topic is there, what it includes, and then drug addiction management. Because I think drug addiction we've had for historically since the beginning of humankind, and we might never be able to get rid of it, but what we have to figure out is how to administer it, how to manage it. And there are the exchange needle places and other rules that could apply to it. So let's go to the first topic, which is economic accessibility. And under economic accessibility, we have a poll that says public health care should be paid by, and if you notice the number one choice there, which most people have voted for, is federal and provincial taxes 100%, universal and comprehensive. Paid 100% by taxes. What do you think about it? Would you, if you were participating in this poll, would you vote for that one, or you would choose another one? Why?
I would. I think that currently, and in the Canadian system, the system that was developed first in Saskatchewan and then across the country, that Medicare and public insurance of healthcare was originally defined as being hospital services and doctor services, principally, right? In other words, primary care and hospital services. And those two services largely are covered by taxation today. Both of those two services, right? They continue to be.
Not 100%.
Well, they do in this sense, that for the most part, the basic hospital services and the basic doctor services are covered. The question is coverage beyond that. There's a whole series of things that are co-pays, right? For example, long-term care. If you need to go into long-term care, or your mom or your dad or your family member needs to go into long-term care, in that case, it's subsidized by the public usually, but a share of that is paid by the person involved. Because the argument has been historically, right, that some of that is health care, right, and some of that is beyond health care, it's living and living expenses. And if you were paying rent and you weren't going in there, you'd be paying those rents anyway. So there's an argument on that. Prescription drugs, which are a growing part of health care, have always only been partly covered, right? Yeah. And so this is where the issue of coverage comes in. And what we know is that those parts of health care that are covered by the public are not only the most accessible, meaning hospital care and primary care, but they're the most efficient. Hospital expenditures as a share of expenditures have dropped from 40% of the healthcare budget to 28%. In other words, the public sector and the public process is more efficient. So not only is it the right thing to do, it's the right thing to do from an economic perspective.
Okay, Adrian, if you had to answer this question in about 20 words or less, to put it here at the bottom. See, at the bottom it says add your choice. If you had to add, because you have a different wording and perhaps...
I just say this, that I think public health care should be funded. There should be a number of things that we agree to that should be funded by the federal and provincial governments. But public health care, things covered by the Canada Health Act, which is a portion of healthcare costs, right? Those things covered by the Canada Health Act should be covered by the taxpayers.
I think what people are afraid of when they say, let's have it paid 100%, is because the erosion of the system goes little by little, saying, well, maybe the meals in the hospital are going to be extra. Maybe the ambulance is going to be extra.
Right.
Maybe you have a tumor, but it's not cancerous, and therefore it's not covered under the Health Act.
And look, I think these issues are real. Let me give you an example of what I mean. MRIs, which is a diagnostic tool to determine what's wrong with you, essentially, right? Presently, the government is rationing MRIs. So for a lot of surgeries, what happens? You need to get an MRI first. The government's rationing the MRI. That's what's happening today.
Because it's too expensive?
Well, they're trying to save money, right?
But Adrian, I have a question.
But the system forces you to do that.
I have a question here. When you say the government is preventing people from having the services, the government doesn't really run the medical services. So who is really behind the government? Perhaps ordered by the government. The government doesn't say you cannot have an MRI.
Yes, they do. The BC Liberal government funds a certain number of MRIs every year in each of the health authorities. They make those budget decisions.
But the MRI machines
are in the hospital.
They're available. It's just that the management of those machines that is not efficient enough.
No, it's not. It's a question of efficiency. Let me give you an example. There are MRI machines in the Fraser Health Authorities that shut down at 11:30 every day because the government has decided to cap the number of MRIs. So they only fund the staff until 11:30. So that MRI machine, which was paid for, strangely enough, by charitable contributions, is left unused for all the remaining time, except for 3 hours
Who makes
of the day.
that decision?
The government. Because if they say to the health authority, we are only paying, I'll give you an example, in 2008, 2009, so April 1, 2008 to March 31, 2009, the government said to the Vancouver Coastal Health Authority, we are funding 28,000 MRIs. Which is an election year, right? In 2009, 2010, the government said, we're only funding 20,500 MRIs. So that meant that...
You mean MRI procedures?
Procedures, yes.
Not MRI machines.
The machines, but the procedures,
Okay. So the funding means the payment for the operators, for the
the funding for the public hospital where the MRI machine is.
Okay. So it's a decision that is invalidating the technology, because the technology is there, but
the technology is there. Just that the government won't spend the money to hire the technologists to perform the procedures.
All right.
And that kind of rationing undermines the public system, obviously.